Baylor College of Medicine and friends of Baylor. We are so lucky today to have Dr. Rola El-Serag, who's the Executive Medical Director of our concierge practice. I'm gonna get the pronunciation right. Concierge practice. And it's exciting because we're not just doing, what people have done before. We're very interested in expanding the offerings so that people can think about healthy living and how they can have a better life. So what I wanted to start off with is just get some terms. So I'm used to the term longevity, which to me means the lifespan of a population. But people are throwing it around. I see longevity clinic. I saw a longevity clinic for dogs. So what is out there? When people talk about longevity clinics, what are they actually saying?
So longevity medicine has come a long way. It makes a lot of us who are academicians nervous, right? Because
It makes me nervous.
Yes,
yeah.
we think of promising people to live forever. We think of the fountain of youth, and frankly, quackery sometimes, right? Because there's a lot of people who are making a lot of money out of gimmicks. But longevity medicine has really come quite a long way because of several factors. The first being that really what we're seeing now is a convergence of several important factors. We understand more and more about the role of lifestyle with longevity. We have rapidly advancing genomics and omics, lipidomics and all the omics, and we have advances in precision imaging. And then we've got information technology, which AI, as you all know, has been rapidly revolutionizing how we practice medicine. And the convergence of all of those factors together, plus genetically engineered drugs and vaccines in addition to that, we really are at a point now where we can bring all of that together using AI and analytic platforms where we can more precisely predict an individual's risk in developing diseases of aging more than ever, and that will allow us to actually prescribe interventions that can reduce their risk of developing disease, of overall mortality, and increasing longevity.
So I was always under the impression that if you had parents or grandparents that lived a long time, you were more likely to be a person that lived a long time. Is there a direct genetic correlation between long life, or is that just sort of a soft association, or what is the genetic basis, or is there one?
Yes, of course, there's a strong genetic component, and here at Baylor we're experts in genetics, and we can do whole genome sequencing for our patients. We can identify individual alleles or groups of alleles in the case of polygenic risk scores, for example, that can identify individuals who are at higher risk of developing age-related diseases. The importance of that is several, but first, it's a very strong motivating factor for people when you tell them that they are at a significant risk of a certain condition. They will work harder. It also directs their healthcare provider to more aggressive interventions to reduce their risk.
I'll be honest with you, when I look in the mirror, I don't need a genetic test to know I'm fat.
And that's clinical phenotyping, and that plays a role. But the other point is, just because you have not chosen your parents carefully and you don't have ideal or optimal genes, that does not mean that there isn't a lot that we can do to improve longevity and health span. You mentioned lifespan. Well, in the field of longevity medicine, we talk about health span, and what that is nobody wants to live forever if they're going to get really old and they're cognitively going to decline and their quality of life is not good. So health span refers to the number of years that you live with a good quality of life. So when we talk about longevity medicine, we talk about not just the absence of disease, but we also talk about being as physically fit as you possibly can be so that you can perform your activities of daily livings and all the things that you enjoy doing in your life. You can maintain healthy support systems and relationships in your life. You can be cognitively intact and mentally intact. And those are all the components of healthy aging.
So I've read a couple of articles. There was one in National Geographic, and then there was one I read in Time magazine about these blue zones. Where they go, there's 6 blue zones or something in the world where they go and people live longer. Like there's one in California and there's one in Japan and
right.
wherever, and one in the Middle East.
Yep.
And when they go and look at those people, it's just that they notice like, well, they lead simple lives, unstressed lives, but they're all different kinds of people that go there. So is it that the zone is what's causing it, or is it a lifestyle, or is it just the interaction between?
It's the interaction, and there's epigenetics, right? And genes are expressed based on the environment that it interacts with and the lifestyle that you live. But there are common themes amongst all of those blue zones. I saw that documentary on Netflix as well. They all have strong social networks and support systems. They all have a sense of purpose in their life. They all are physically active. They all have healthy diets, mostly Mediterranean-based diets. And so those are some of the common themes that we see, and still the backbone of longevity and healthy aging. But again, there's so much more now that we can add to that to be able to extend.
It seems to me that there's so many factors. It's hard for an individual to sort of navigate this. I know there's several popular books that have come out. But how is what you do? How's our clinic going to sort of change that? How do you integrate all the data that's out there, the information that's out there, to help advise an individual how they can lead a healthier life?
I think that's the key question. Several people that I've spoken to have an interest in this area say that they get stuck at and then what?
Yeah.
You get all this information, but then what do you do with it? And so this is where I think the process is collecting different information, whether it be genomic information or metabolomics, it could be biological markers, it could be phenotyping, either clinical or biological, precision imaging, and so on and so forth. It's a lot of information to collect. And then we can use AI platforms. These are analytic platforms now that can actually integrate all of this data and provide a health summary for an individual and allow that individual to have a better understanding at their own level of understanding, right? So that the actual patient can understand it. And then we practice precision medicine. The individual will prioritize their goals and what they want to achieve. And AI can actually be prescriptive, and it can actually create a journey for an individual patient in the goals that they want to achieve.
Well, that sounds great.
And I think that's where we can really shine here.
I don't think there's any place that actually does that. So good luck with that, as we say. It's a lot to do, but if you could do it, it'd be pretty awesome. What are there tests now that are available that sort of tell you how you're doing? I know you get your cholesterol measured. Are there, physical things? I remember when getting to a higher level in a treadmill predicted, forget your heart disease, it just predicted whether you'd live a longer life.
And you bring up a good point, because exercise is the single most important factor. I know not everybody loves to exercise, but if we could put it into a pill, it would be the ideal pill to improve longevity. And so that is a key component, but there are many tests that we can do. In the concierge clinic, we offer body composition, because we know body composition and muscle mass is a key predictor of longevity. And it can be measured, and you can be prescribed specific, exercise routines and other things, therapies, and monitor it over time and see an improvement in that will actually be associated with an improvement in longevity.
So you told me something just a second ago that VO2 max was associated with.
Correct. The second thing that we do in the concierge practice is the VO2 max, which measures several things, but essentially the oxygen consumption during exercise, during peak exercise. It is strongly correlated with longevity and mortality, total mortality as well, and cardiovascular mortality. And that is something that can be measured over time. It can be improved and demonstrated also that can improve extend your lifespan. So those are some of them. And then there are other tests there are things like biological clocks that look at things like DNA methylation and telomere lengths that can actually give you a sense of what your biological age is, and you can compare it to your actual age. And the interesting thing is that if you are prescribed a regimen to improve those parameters, you can see your biological age improve.
Is
over
that
time.
right? Okay. So we had actually a discussion with Peggy Goodell, who studies some hematopoietic stem cells, and she was talking about methylation as a marker for aging in cells, as actually give a biological marker for aging. So is that kind of what you're talking about?
And I am in the process of looking at some of the available testing for that. I'm not sure yet that we're ready to be offering those types of tests, but we're almost there.
Yeah, I'd hate to give you a blood sample and say, well, you look 60, but your age
actually
is
100.
200. It's like, no, everybody be circling around me like we had vultures visit my office and they'd be back. Anyway, so the other interesting thing to me was some of some of the benefits, for example, of the statins that people didn't realize that there's kind of decrease in general inflammation. And they're even talking about that with the GLP-1 agonist now. So is there a common sort of biological issue that's going on that these drugs tend to lower inflammatory state?
Inflammation is key. We don't really understand exactly how it works, but we do know things like the high sensitivity CRP levels are associated with and correlate with longevity and mortality and all of those things. And we know that drugs like, for example, the GLP-1s do reduce high sensitivity CRP. And those drugs also, I mean, there is no drug available that will reverse aging or, promise you to live longer. However, the GLP-1s can do a lot. And what they do is they reduce the risks of the four horsemen that Peter Attia refers to that kill most people, right? Cardiovascular disease, metabolic, and neurodegenerative diseases, and cancer.
And I had a fifth one, poverty, because the cost of the GLP-1 agonist is like $1 billion. So you can live long enough, but you're going to live poor.
And, if you want to ask me about what are some of the barriers or obstacles in longevity medicine, it's the social determinants of health.
Yeah,
Because
of course.
the access to this, of course, is only to the lifestyles of the rich and famous at this time. But, over time, hopefully, as we implement these things and they become, they show good outcomes, we can.
I would if you start this. When are you going to start this? Because I want to just sign up. Unlike what you said, I want to live forever.
Well, we have an alpha and a beta patient who we will officially start in September.
Okay.
And then we will be adding people. I think this is badly needed. A lot of people have expressed interest in it, and we already probably have a long waiting list. But
Well, put Lily on the list because she wants to. She's already told me she wants to
they're
outlive me.
testing rapamycin in dogs.
I
I would not give Lily rapamycin.
I'm not
no.
giving it to, but I do. I'm aware, and I've talked about this in one of my Friday videos that there's a longevity in dogs study going on that they're given, and rapamycin is being given as one of the limbs.
Yeah.
Yeah.
And the other barrier or obstacle, since we're talking about rapamycin, is we have to be very careful as responsible academicians and scientists about not overpromising and exposing our patients to more harm than benefit.
Well, one of the examples, I've had many people come and say, I want a high resolution CT scan, and I go like, really, you don't? But, or high resolution or total body MRIs.
Right.
That's people are spending a lot of money for that. But what's your sense about those?
The challenge for me is to really, the way I see this is we're going to categorize what we offer what we don't offer in three major categories, which is we recommend it, we don't recommend it, but if you're going to do it, it's okay because it probably won't harm you. And then the absolutely, like rapamycin, we do not recommend this, don't do this. We understand that patients do have the ability to make their own decisions if they understand if we are responsible scientists and produce and provide them with the right information. And I think that's how things will go with this particular.
Great. Well, I'm really excited about this, and I think it's a wonderful initiative, and thank you for doing it. And I'm sure everyone will be really excited to get updates, and I'll be having you back to give us updates and answer some tough questions in the future. So thank you very, very much.